Addiction doesn't have to be a landing place. Let's talk to the prevention officers from Harbor House who work hand in hand with the Sebastian County Opiate Drug Task Force to reduce addictions. We will hear how one woman decided to change her life.
My name is Tabitha Fondren.
And I'm Katie Priest, and we work for Harbor House, Inc. as the Region 5 prevention providers.
As a Region 5 prevention provider, Katie and I cover 6 counties, providing education and raising awareness for substance use.
So as the Region 5 prevention providers, we are part of a network of prevention providers across the state of Arkansas. So there are actually 13 regions, and they all do similar jobs as to what we provide our communities. We cover 6 counties in Region 5, and we provide education, trainings, brochures, information to the public, and really we act as a support for our communities in enacting change as it comes to substance use and prevention. As it pertains to the Opioid Task Force, we focus our prevention efforts on opioids. So we provide educations within the schools, specifically the Fort Smith School District. We have a great working relationship with them. So when we go and do our presentations at the school, we talk to a classroom size of students, and we are able to give them not only the education piece, but also the encouragement. We give them ways to say no, and we actually practice those in our classes.
My heart definitely belongs to prevention. I'm helping raise awareness and educate young people about the dangers of different types of drugs and alcohol. I started using drugs when I was 15 years old. My first drug was methamphetamine, and it quickly destroyed my life. Everything that was important to me became not so important. Family, friends, school, track, basketball, everything that, when we think of what a young person at 9th grade likes to do, we think of going out with friends, and my story looked like getting a job and trying to hide my addiction at an early age. So by the time I was 20 years old, I was using drugs intravenously with a completely different crowd, and that took my life to depths that I never thought I would go to. Most people that I know, when they start using drugs, they have a list of nevers. Like, I'm never going to use this type of drug. I'm never going to be addicted. I'm never going to end up like so-and-so. I'm never going to drop out of school. Nevers, the word never is, I try not to use the word never in my vocabulary, because unfortunately most of the things I said I would never do, I did. I moved to California. I left my family. I became homeless. I didn't have a job. I lived on the streets. I eventually started using heroin, and heroin, every time I use a new drug, it took me to a new low. So heroin gave a new meaning to the word addiction with me and my story. I did things for drugs that I'm ashamed of. I disappointed my family. I disappointed myself. Most importantly, I disappointed God. I was living for the disease of addiction. I truly believe, just as the task force believes, that this opioid epidemic needs to be treated like a disease, which it is. And so I never knew any of that. All I knew was that at one point in my life, I felt like I didn't fit in, I was inadequate, my grades weren't good enough, I wasn't good enough in track, I wasn't good enough in basketball, and then all of a sudden, I found methamphetamine and then eventually heroin, and nothing mattered, unfortunately. All those things that I'd given up, my freedom, and when we say freedom, I do mean freedom like outside. I was incarcerated, but I also mean freedom from myself. I was a slave to addiction. So had someone maybe known first that I was using, and had someone taught me differently, I could think of 1,000 reasons and excuses and the what ifs, but ultimately I believe in prevention, and I believe in spreading the message, because we may be that one source that someone hears. It's okay to talk about it. It's okay to be struggling. It's okay to not feel like you fit in. What can we do to help you? How can we make this look differently? Katie and I, sometimes we go into schools and provide presentations, and with students coming up to us after, and they tell us about their mom or their dad or their grandma or their grandpa, and you see the hurt in their eyes, and we're able to give them a resource to let them know that this is what you can do. I don't remember that being an option so many years ago, but today it is. Today it looks like Region 5 prevention providers, and fortunately we have these all across the state. Katie and I are just a small piece of the puzzle. And now we get to work with the Sebastian County Opioid Task Force and providing more education and more awareness and being part of campaigns that, to me, an addict like me, because I do believe I'm still a recovering addict, to an addict like me, I never thought was possible. Partnering with law enforcement, being friends with law enforcement, getting a pardon from the governor. You know, I'm going to vote for the President of the United States for the very first time this year, which is a big thing. So I know I can speak for Katie also. When we go into the schools or to the community events, the health fairs, the libraries, Mercy Hospital, we're not going there as just looking at it like it's a job. Fortunately, we do get paid for what we do, but it's much, much more than that for myself and for Katie. You know, we're looking to change lives. We're looking to make a difference, to be the difference, to see the change. That's what we wake up to do every day with a goal in mind of helping reduce substance use as a whole. I was 27 years old when I got clean, and I did that with the help of Sebastian County Drug Court. And ultimately, Sebastian County Drug Court sent me to treatment at Gateway, and there I stayed for 6 months to learn how to be a mother, a daughter, an employee, a friend, a child of God. I struggled in the beginning, and something I think it's so important for people to know is that no one wakes up thinking, I want to be an addict, especially when we talk about opioids. When a person uses an opioid, and it may be because they broke their arm, because they broke their leg, next thing you know, they're addicted and they're struggling, and it's a real issue. It's a disease of addiction. It's an obsession and compulsive disorder to use more and get more, ending a lot of people with the end result being on heroin. My story with the switch from Maryland to heroin didn't quite look like that, but I hear that so much in Narcotics Anonymous and in the field that I work in. And I just want to help save a life. I know that Katie and I want to help save a life. And if we can do that by being a part of the Sebastian County Opioid Task Force and helping raise awareness and teaching others about Narcan, an opioid reversal, it actually helps a person not die from an opioid overdose, for someone to not have to go down the road that I went down.
One of the most important things that you can do as a parent is to talk to your kids about drugs and alcohol. It really starts in the home. Tabitha and I can come and talk to your child while they're at school, but we're only there for a short time. And one of the best resources that we have that we can give to you is to direct you to the Talk They Hear You campaign. And that's provided by SAMHSA. And it really just leads you through how to talk and how to start that conversation with your child. So what are some effective ways and what are some ineffective ways? And how can you get your message across that you care about what they do with their lives? Research shows that one of the most effective ways at keeping kids away from drugs and alcohol is to start that conversation in the home. So really you have the power to help prevent your child from becoming the next addict. Because unfortunately, everyone likes to think that it won't be their child, but it's going to be someone's child. So we just encourage you to not let it be yours.